Hello, everyone, and thank you for tuning in. Today, we're talking about two neurodevelopmental conditions, ADHD, attention deficit hyperactivity disorder, and dyslexia. We are thrilled to have Dr. Rachel Gao for this discussion. She is joining us from London. Dr. Gao is one of the UK's leading experts on the role of nutrition in ADHD and neurodevelopmental conditions. She earned her PhD in child neuropsychology at the Institute of Psychiatry in King's College London, where her research explored the relationship between omega-3 fatty acids and ADHD symptoms, memory performance, and emotional regulation using EEG brain activity and recordings. She has also worked as a guest researcher here in the US at the National Institute of Health in Maryland, contributing to the world's first clinical trial on omega-3's role in reward-related brain processes in adults with ADHD. Dr. Gao is also the author of the book Smart Foods for ADHD and Brain Health: How Nutrition Influences Cognitive Function, Behavior, and Mood. I have a copy of it right here, and it's a great book, great real-life stories, science-backed suggestions for nutrition, very worthwhile reading. And on top of all that, she is also the proud mom of a child with ADHD. Welcome, Dr. Gao.
Thank you very much. That was a wonderful introduction.
So I want to start at the beginning of your
Sure.
journey into nutritional neuroscience. So your transition into nutritional neuroscience is fascinating, and it seems like your personal experience shaped your passion for this field. Can you share with our listeners how your journey began?
Yeah, absolutely. So I was a relatively young first-time mom, and I was working in the world of property, as Americans call real estate, in quite a famous place in London called St John's Wood on Abbey Road, which was the front cover of the Beatles cover many moons ago. And my son was at a school literally a stone's throw from my office. And I absolutely loved my job, but I noticed that my son wasn't successfully settling in to reception and year one. The teachers were complaining about sort of low level disruptive behavior, just fidgeting and doodling at his desk. So when the teacher was talking, my son would be drawing, sort of scribbling. And we now know that, in fact, that really helps children who have deficits. It helps them actually pay better attention. But back then, of course, we didn't have that knowledge. And so my son was a bit fidgety, restless, and just generally struggling. So there's lots of meetings, and I sought out assistance from educational psychologists, clinical psychologists, eventually child and adolescent psychiatrists, who diagnosed my son with ADHD and dyslexia. I knew very little about these neurodevelopmental conditions. And then after a lot of soul searching, I decided that I would have to leave my career in property. And I decided to enroll as a mature student at university to study a Bachelor of Science in psychology so that I could attempt to better understand some of these diagnostic labels. And that ended up sort of snowballing into 14 years of study. So quite the journey.
Wow. You know, it's interesting. Many parents of neurodivergent children develop such unstoppable drive to better understand their child's need. Your story is such an inspiring example of that, and thank you for what you're doing, because I think a lot of people, a lot of parents, and a lot of children will be benefiting, have already and will be.
Thank you.
So I want to talk a little bit about understanding ADHD and dyslexia. There's been a lot of discussion recently about ADHD, especially on social media. Many high-profile individuals like Paris Hilton, Trevor Noah have openly shared their diagnosis. And with so many symptoms being so widely discussed, people may wonder sometimes if their child fit into some of these categories. Like I sometimes think to myself, I know a lot of people that might fit at least one or two of these descriptions. And I wonder if we should be paying more attention. So can you help define for our listeners ADHD and dyslexia scientifically, and share some of the early signs that parents should be aware of when considering going for a diagnosis?
Yeah, absolutely. ADHD, attention deficit hyperactivity disorder, is considered one of the most pervasive neurodevelopmental conditions diagnosed in children. So it does exist cross-culturally, so it can be diagnosed in Asia, in Africa, in Europe. It has global estimates in terms of prevalence of somewhere between 6 to 11%. So symptoms normally emerge in the developmental period, certainly by the age of 12, although my own son now can look back and recognize symptoms in him as young as 2 and 3. ADHD does persist into adulthood, normally in at least 65% of all cases. That's probably that estimate's probably conservative. Although, people do learn compensatory mechanisms which help them cope better, and oftentimes symptoms are less obvious in adulthood following a child diagnosis. The etiology is complex. There's evidence for a combination of both genes and environmental influences. The environmental influences are anything from nutritional insufficiencies, my key area of research, to deprivation, trauma, toxicity, infectious disease, and so on. So it's a complex interplay between the genes and the environment, and emerging research is really demonstrating that ADHD is likely an epigenetic manifestation. So the core features are characterized by 6 or more symptoms of either the what's called the predominantly inattentive presentation, or the hyperactive impulsive type, or a combination of both. So oftentimes individuals with ADHD may present with cognitive or neuropsychological impairments, particularly in what's called frontal lobe, higher order executive functioning, which we can talk about a little bit more later, but things like decision making, forward thinking, goal planning, some emotion regulation, and so on. It's also oftentimes you will see what's called motivational deficits. So children will struggle, and as will adults as well. This is potentially mediated by lower dopamine. So dopamine is not just associated with reward, it's what gets us out of bed in the morning. It's important to notice. But yeah, common symptoms are things like procrastination, distraction, mind wandering, disorganization, impulsive behavior, so reactive behavior, so acting first, thinking later, a tendency to self-medicate, which we can talk about later, especially in adults. And there's a 50% increased risk of the development of substance use disorder. Other addictive behaviors, little to no filter, very talkative, dominating conversations, frequent interruptions in the conversations of others, struggle to follow through, cognitive restlessness, tendency for increased depression, anxiety. However, there are also very great strengths as well. In some cases, there are superlative skill sets. And in my own research, I have found that IQ basically is, within the normal bell-shaped curve. So it's either average, above average, below average. And intellect is variable, as you would find in the normal population.
Wow, you touched on so many things, and I have so many follow-up questions, but let me just go back to the numbers. So I saw a CDC study that was done through a national survey of parents using, I think it was 2022 data, where it estimated numbers very similar to what you said. 7 million children in the US, which is about 11%, something like that, between the ages of 3 to 17 years that have ever been diagnosed with ADHD. And then there was this global meta-analysis in the Journal of, I think, Affective Disorders that also found very similar numbers to what you just mentioned worldwide. And what I thought was interesting was that boys seem to be twice as likely to be diagnosed as girls. And I can't quite understand, is there a reason for that, or is it more that just girls kind of pass by without being diagnosed?
Yeah, it's a really interesting point. I think the ratio used to be 4 to 1. So
Mm,
there would be 4 males to every 1 female diagnosed, but it's now 3 to 1, so it is catching up. And I think it's because symptoms present differently in females compared to males. And also, oftentimes, a lot of the research conducted in ADHD was conducted with male, school age children or adult males. And that created a
mm.
kind of a bias in the research and the research findings
I
because
see.
it's only conducted in, right-handed males. But females don't always present with the ADD subtype, but there is this belief that girls oftentimes are kind of more of the head in the cloud, kind of daydreaming. They present with very covert symptoms, so concealed symptoms, whereas boys present with more overt behaviors. They're more likely to have what's called externalizing behaviors. They're more likely to act out. They're more likely to be reactive. If there's an incident in the school playground, they're more likely to be reactive in terms of, pushing someone over or thumping someone and then getting into trouble, getting labeled very quickly as being potentially disruptive. And then, as I said, they're more likely to get the referral to the child psychiatrist and therefore get the diagnosis. So I don't necessarily think it is that this condition is predominantly a male condition as previously thought. Kind of notion is quite archaic and outdated now. We know that there's a whole what's called lost generation of women who are only now in their 40s, 50s, 60s, 70s, and even these getting diagnosed with autism and ADHD, having had a lifetime of challenges and struggles.
Amazing. And then, that same study that I mentioned earlier talked about the inattentive ADHD being the most common subtype. I'm wondering, is that because it's more often diagnosed in males, or is there something actually about the inattentive type that sort of surfaces more than the hyperactive or the combined types? Like, what's the correlation there? Is there one?
I think first and foremost, these conditions often don't present in what's called kind of pure cases. They're highly comorbid, which means they are much more likely to overlap with other related conditions. For example, about 87% of individuals with ADHD have at least one other condition, which adds to the complexity and potentially increases associative risks. Dyslexia, for example, is very common. Like, as I mentioned earlier, my son was diagnosed with both ADHD and dyslexia, but also autistic traits as well. There is quite a significant, sizable overlap. So, does the young person have dyslexia and ADD? Well, probably because they're very similar in terms of their behavioral presentation, that disorganization component, that struggle to follow through. Does that make sense?
Yeah, yeah. So I want to talk a little bit about the emotional side of ADHD because I think it's often associated, or ADHD is often associated with attention difficulties, right? The hyperactivity. But I think, as you mentioned also in your book, and there's been quite a few articles written on this about the lesser known side of like the emotional side. How would a parent differentiate, for example, between maybe a naturally shy child and one experiencing emotional challenges that are linked to ADHD if the child hasn't been diagnosed, for example?
Yeah, I mean that's a tough question. The emotional dysregulation side is often seen in children with ADHD. It taps into the
Mhm.
kind of hyperactive impulsive component. Children with ADD, the inattentive subtype, may have more likely to have depression and anxiety, which are not always particularly obvious. And it can be linked to also like low self-esteem. Children with ADHD are often reprimanded and on the receiving end of a lot of negative criticism, from their
Yeah.
teachers, not paying attention, or maybe losing items needed for school, turning up with the wrong books, forgetting PE kits and things like that, very, very common. So they're often getting into trouble a lot, which can then impact their self-esteem, feelings of self-worth, which then obviously can strip away their self-esteem over time. It's like imagine going into work every day and you have a horrible boss And every day he's
Yeah.
looking at you and finding fault in things that you haven't done, should have done, didn't pay attention, should be paying attention better, and didn't, take down the requirements of the task that he set you and delivered the wrong thing and all the rest of it. Well, after a while, that's going to have an impact on you. It's going to, strip away some of your self-esteem, how you feel. You feel like you can't do anything right. Well, it's very similar for a child with ADHD. I often say that there's great difficulty in trying to communicate to teachers that oftentimes children have this internal struggle to self-regulate, and they're being told off for the very symptoms that they're struggling to regulate. And if a child came to school, in a wheelchair, you wouldn't be telling that child on a daily basis to stand up and walk, would you? But these children are frequently being told to, pay attention better, and all the very symptoms that they're actually being medicated for, they're struggling with.
Yeah. Yeah. I want to go back to education, but I want to ask you another question. The diagnosis side of ADHD. So typically, diagnoses involve clinical interviews, behavioral interviews, psychological testing. What about MRIs being utilized? Currently, they're utilized in the research of ADHD, but what about utilizing MRIs to help with the diagnosis of ADHD? Perhaps to look at the brain impulsivity or organization, certain areas of the brain. Could it possibly have a role in helping the diagnosis, do you think?
I mean, I don't think we're there yet, but certainly in order to build up a picture or to guide the clinical judgment of the psychiatrist, neuroimaging can certainly be helpful. There is quite a pushback, in fact, to utilize neuroimaging because there's such sort of wide variability in neuroimaging findings as well that makes some of the results questionable at times. In other words, the reliability of the findings, which can differ according to the different machines and the imaging machines that are being used, the different statistical analysis, and so on. So the reliability is questionable, but certainly utilizing neuroimaging in research is incredibly helpful to look at differences in brain activity, function, structure. Replicating those findings has been fairly consistent, but not completely consistent. Hence, the concerns about reliability. So yes, I mean, while psychiatry is probably one of the few medical fields that doesn't look at the very organ that it's diagnosing, and I know that Dr. Daniel Amen makes reference to this frequently, and it's an important point. If you've got something wrong with your kidney, you'll get an ultrasound, or if you've got something wrong with your lungs, you'll get an X-ray. But if you've got something wrong with your brain, then there's a very different approach. It's more kind of looking at symptoms, and yeah, it's framed completely differently. And I don't think we can be wholly reliant on just symptoms, because symptoms, what is underlying the symptoms is really important. Like, a lot of people don't take the time to have a holistic, integrative approach to brain health. For example, when you go to your GP, say you're feeling irritable or fatigued, you've got low mood, it's been persistent for some time, that doctor's likely to read a series of sort of statements from a computer screen. Depending where you fit on the threshold, the prescription pad will come out. You're likely to be diagnosed with having some sort of depression and be given a selective serotonin reuptake inhibitor, and told to come back in 3 to 6 months. And certainly in England, I mean, if you're lucky, you might get a referral to some talking therapy, but that's about your lot. And the question, what do you eat, seldom or never features in that initial appraisal or screening, mental health screening. And that's a shame, because we know that sort of B vitamins and folate and omega-3 fatty acids and vitamin D kind of work together to help make serotonin, the neurotransmitter that governs kind of well-being and that kind of stable contentment. So yeah, I mean, it's difficult because a lot of medical students, don't receive any training in nutrition. They might get a couple of hours, and they're certainly not going to know the effect size of omega-3 fatty acids in depression, for example. Then they're probably not going to understand about nutrient synergy and the importance of specific kind of brain selective nutrients to help regulate neurotransmitter systems. So yeah, that's difficult as well.
Yeah. So, you mentioned something earlier, which was something's wrong with your kidneys. You get a, scan of the kidneys or something like that. So I think that's actually is the point, right? A
Mm,
objective way of looking at the organ that you're trying to understand.
yeah,
And that's the question about the MRI, but I understand what you're saying in terms of it's not quite there yet in terms of a,
reliability. Yeah.
yeah, yeah.
It's certainly helpful to guide clinical judgment for sure, absolutely. And I do feel that obviously I advocate for the inclusion of nutritional medicine in psychiatry. I strongly believe that anyone presenting with any type of mental health struggle or difficulty should be simultaneously referred to a dietitian or a nutritionist to assess specific nutrient insufficiencies, which we know help regulate, as I said, the dopaminergic and serotonergic systems of the brain. So I do think that that should happen. And I also think that, looking at the brain neuroscientifically is also potentially useful, but we're not there in terms of using it as a specific tool for diagnosing.
Right. So I want to go back to something you mentioned earlier, which was the omega-3s. So you did a lot of research at the NIH exploring the omega-3 supplementation effects on adults with ADHD. Can you walk us through what that study was and what were the findings of that study?
Yeah, I mean, most of my research has been with omega-3 fatty acids. So at King's College London, we took blood draws from children with and without ADHD, and we looked at their omega-3 fatty acid levels and correlations, so relationships with brain activity during specific kind of cognitive and emotion processing tasks. While I was at the NIH, co-designed and ran the world's first randomized placebo-controlled clinical trial, testing for the first time omega-3 in the brain function of adults with ADHD, specifically looking at reward-related processes. And we had this hypothesis that high dose omega-3, like 3 grams, which is approved by the FDA as safe and tolerable, so up to 3 grams of eicosapentaenoic acid, so EPA, combined with docosahexaenoic acid, DHA, together compared to a placebo. We wanted to see if potentially that could improve reward-related responses. So looking specifically at a region in the brain called the ventral striatum and looking at ventral striatal bulb activation, and whether that increased following high dose omega-3, because we know that the reward responses in the brain in ADHD are diminished oftentimes. Several researchers before us had already conducted that research, like Nora Volkov, head of NIDA, and several other people had kind of replicated that finding of hypo-responsiveness in relation to ventral striatal bulb activation responses, which simply means that their responses to reward are decreased in activation compared to individuals who are not diagnosed with ADHD. So they don't get as excited by monetary rewards in the same way that their counterparts might, as captured during that MRI scan. So they have the option and to win rewards essentially in real time. So they're sort of playing a game in the MRI machine. And the region of the brain that's involved in that reward related response is the ventral striatum. So it's like the reward hub of the brain. So yeah, so we were looking at whether omega-3 could mediate their responses to reward, put simply.
Yeah, it's a very interesting study. And I want to stay on the topic of nutrition because also in your book you talk a lot about different aspects of how the role of nutrition in brain and gut function and things like that. But I wanted to ask you, many parents rely, I guess, because their physicians have made the suggestion to have medication as a first solution, while nutrition is very often overlooked. So, why do you think that the nutrition aspect isn't as emphasized as much as medication in ADHD treatment? Is it a lack of knowledge? Is it a lack of belief that it has the impact that it has? What is it about the nutrition that is sort of doesn't come up in these prescribed treatments?
Yeah, I mean it's quite complex, and we could be here all day answering this one. But first and foremost, nutrition research is very hard to conduct because psychiatrists who are working in the field of nutritional psychiatry or neuroscience often isolate specific nutrients like omega-3 fatty acids. And then when they conduct what's called the gold standard of research, which is the randomized placebo-controlled clinical trial, they take a group of children with ADHD and maybe compare them to children without ADHD, or they put the children with ADHD into two groups with the active, say, omega-3 supplementation versus the dummy, the placebo, and then they draw comparisons. However, there are lots of arguably flaws in the method and design of that trial. For example, first and foremost, nutrients don't work in isolation, they work in synergy. So when you eat a piece of fish, for example, you don't just get the omega-3s, but you get the vitamins and the trace elements that are needed for synthesis and absorption into our red blood cells. So you get the omega-3 and the multivitamin, you get the iron, the iodine, the magnesium, the selenium, the zinc, and you get all of that together. Now, when you do a clinical trial, oftentimes, the researcher isn't looking at the child's background diet to see what they're eating. And we know that omega-3 from oily fish and seafood or plant-based sources compete with omega-6, normally present in, ultra processed foods, so kind of junk and processed foods, oftentimes rich in omega-6 via the inclusion of sort of soybean oil predominantly, which is in everything. And omega-3 and omega-6 compete for absorption and synthesis. So if you're giving a child a 1 gram omega-3 pill every day, but yet they're, eating pastries and biscuits and crisps and pizzas and that type of thing, refined processed foods, then the majority of their diet is going to be omega-6. So that omega-3 is not even going to be absorbed. So when you finish the trial 12 weeks later, you don't have the finding that was anticipated. So you have like a negative finding, if you like. And this is what gets published. This is what makes headline news. Omega-3 is ineffective. You're wasting your money, put your supplements in the bin, sort of thing. This is what happens all the time. It's the kind of lack of nutritional biochemistry, understanding how omega-3s work in the body, understanding the biochemical pathways, understanding there's a multitude of factors which influence, the conversion and absorption of omega-3, for example, just keeping that as an example, such as your background diet, but also your genetics, your age. So it's complex, it's highly, highly complex. So, and also bear in mind what I said earlier, that our medical students don't receive nutritional training or education. These medical students become our health practitioners. These health practitioners are the ones that are prescribing methylphenidate, and all they know about is the biomedical disease model of symptom management. They don't know about the nutritional research, or they may know a little, but they may not understand it. So yeah, I guess it's a lack of nutritional education. It's the way our doctors are trained. And, methylphenidate can be highly effective. It has a large effect size. Oftentimes it can normalize brain activity in children with ADHD compared to controls. However, the long-term efficacy is questionable, and it wanes between 1 and 2 years. The efficacy has waned considerably to the point where the drug is no longer effective and has to be reassessed in terms of what that young person is taking. Being on stimulant medication also comes with other side effects and risks, as we now know, because it's been widely published in the last couple of years looking at the impacts to the heart, for example. So yeah.
Yeah, I see the complexity of it. Yeah, some of the things you described though are very interesting and I think unknown, such as the competition between omega-3 digestion and omega-6 and, you know, the fight for absorption. That's very interesting because it's probably a lot of what you said. You eat the Oreo cookie, but you had fish for lunch.
Yeah, or in your
Those,
fish in rapeseed oil or some omega-6 rich oil, and you have no idea.
right.
Yeah.
Yeah, that's very, very helpful because I think, people might look at, okay, let me see what's published. And if the publishing says, well, it wasn't effective compared to the placebo, but you don't have the knowledge to ask these other more complex questions.
I think also that it's more complex than that as well. Humans are kind of almost wired to seek pleasure and avoid pain, and
True.
making dietary changes can be incredibly challenging for the majority of us who've been hardwired to see sort of sugar-rich, ultra-processed foods as rewards. So, we're rewarding children as young as 2 and 3 with chocolate, candy, all these ultra processed foods, trips to fast food takeaway restaurants. And we are setting our children up themselves, arguably, for problematic eating. And, oftentimes children who are socialized from a young age into eating a lot of these types of foods, like I said, it can become hardwired. So you almost have to kind of rewire your brain and undo through kind of synaptic pruning, to
Mm,
weaken that pathway between food equals reward. I mean, obviously, food is
yeah.
rewarding, but healthy foods are rewarding. They can help you naturally regulate your neurotransmitter function. So there are foods that help and there are foods that hinder. And foods arguably are addictive. Food scientists have paid a lot of money to create that bliss point, effect that is sought after. It releases dopamine. You get that little feeling of euphoria. You feel good, you go back for more. It's like any substance, the habitual consumption of any type of substance are creating those neural pathways in your brain.
Yeah. So true. So true. Have you encountered resistance when you promote nutrition first approach in your talks, even in your book? Have you gotten negative feedback?
Yeah, yeah, of course.
Hmm.
Oftentimes I find that there's such resistance against people like myself, who are highly trained professionals, kind of trying to encourage and provide nutritional education to help. Yeah, there's a lot of resistance, there's a lot of kickback. It can be a struggle, but I think, like I said, it's just very, very complex and it kind of taps into your own belief system. Some people
Mm,
could
mm.
misinterpret your efforts as maybe trying to sort of food shame, or, we need to take away any blame from individuals and put it back onto the food industry, quite frankly, because they're creating this stuff.
Yes, this is true. This is true. I wanted to ask you another question. So in your book, highlight the role of key nutrients, omega-3 fatty acids, zinc, iron, magnesium, the B vitamins. I also saw a very interesting Serbian study published, I think, in 2024 in the journal Children that found very similar results to what you mentioned with individuals with ADHD that had significantly elevated levels of the amino acid homocysteine, as well as
Mhm.
iron and ferritin. And they also found that vitamin B12 levels were significantly lowered compared to neurotypical children. And you mentioned some of these things in your book as well. So my question is, should parents proactively discuss specific nutritional blood work and supplementation with their pediatrician if they suspect their child may be having signs of ADHD? Or is it that once the child is diagnosed, then the blood work should be done and the nutritional supplementation
I guess it
be
depends which
introduced?
country you live in, because if you're in America, you can get a diagnosis pretty quickly. if you have private healthcare. Yeah, I mean, whereas we rely on the NHS and you could be waiting 2 to 10 years for a diagnosis. Currently, there's this kind of political pushback in giving ADHD diagnoses, and there's almost like an agenda to kind of reserve diagnoses for those that are most chronically impaired because they are concerned here about overdiagnosing, and many people coming forward with better recognition and better awareness, looking at their own lives, seeking out diagnoses. So, like I said, it depends which country you're in. I mean, I always say foods first. So, any parent that has a concern about their child, obviously, it depends what age that child is. If the child is under 6, then wait till they're at least 6 or 7. And in the meantime, do everything you can. There's no reason why you can't seek out the help of a nutritionist and discuss maybe problematic behavior, eating patterns. There's so many articles now showing, and when I say articles, I mean published science, peer-reviewed science, looking
Right.
at the relationships between the gut in autism. So the gut microbiota in autism as well. There's a lot of emerging trending research now showing the complexities of some of these bidirectional relationships. But yeah, I mean, there are around 40 essential nutrients required for human bodily and brain function and health. And understanding the importance of brain health, the function of neurotransmitter systems, the average parent doesn't have this knowledge. It's
Yeah.
really hard. I
Yeah.
mean, until I started studying, I didn't really pay any attention to the role of nutrition in the brain. I understood the importance in terms of the prevention of specific chronic metabolic health related diseases, non-communicable diseases, to prevent type 2 obesity and diabetes and stroke and cardiovascular disease, and even for weight loss. Yes, of course,
Right.
nutrition's for weight loss, but when you explain to a parent that what you feed your child is going to potentially contribute to their learning in the classroom, to their cognition, to their mood, to how well they sleep, to their emotional regulation, find that a lot of parents are surprised to learn this. And, when we go to school, we're not taught about neurotransmitters, we're not taught about dopamine or serotonin or GABA. We're certainly not taught much about the nutritional sciences. We're not taught anything much about the brain. Most children leave school, they haven't a clue, the functional location of the cerebellum or the insula or the anterior cingulate cortex. It's all gobbledygook. It means nothing to them, and we need to kind of pass on this critical nutritional education to parents. We need to teach them about amino acids, like you mentioned, which are critical for neurotransmission. We need to talk about omega-3 fatty acids. EPA and DHA helps regulate serotonin and dopamine, helps with cell signaling, chemical messaging across our brain's networks, helps with sleep. And we need to teach them about, the importance of specific vitamins, for example, like vitamin B and vitamin D, choline,
Mhm.
minerals, trace elements, antioxidants, polyphenol. We need to protect the health of our brain, and we can do that nutritionally. We can build brain health resilience, but we can only do that with the nutritional education, like knowing how to eat for brain health, and in particular, which essential nutrients help regulate the systems which govern mood and well-being. That is critical.
Right, right. I want to get back to education, but I want to ask you a question regarding these nutrients before we move to that. Do you think that amino acids and minerals and some of these vitamins could potentially be used as biomarkers as part of the ADHD diagnostic process? Would that be feasible?
Well, that's a good point, actually. I've just submitted a paper which is under review for consideration of publication with my research team at the University of Roehampton in London. And we spent the last year looking at a sizable data set that I've been putting together on psychological and nutrition data in children and adults with ADHD and neurodivergence. And what we found is a range of nutritional insufficiencies. 100% of the group had food intolerances, interestingly, to cow's milk, other
Oh,
dairy, wheat, to gluten. We also looked at relationships between, for example, low omega-3 fatty acids, increase risk of learning and language disorder problems. We found that low magnesium was linked to increased risk of disruptive behavior. So we're about to publish this. To answer your question specifically, I don't think we're ready in terms of biomarkers, but certainly the omega-3 index is being used increasingly in psychiatric, nutritional psychiatric research. So the omega-3 index, which is the sum of EPA and DHA, essentially the index is 0 to 4 is suboptimal levels, 4 to 8 is intermediate, and 8 to 12 is where we should all be and is optimal for everyone. That was developed by researchers called Bill Harris and Clements von Schaake, who found that the omega-3 index was a sizable predictor for the development of cardiovascular disease. Well, we know that there's a 50% robust correlation, 50% likelihood that those that have cardiovascular disease have depression and vice versa. It's a bidirectional relationship. It's commonly known. There is that age-old saying that dis-ease of the mind equals disease of the body, you know? And
Yeah.
the omega-3 index is being used in psychiatry now to look at the relationship, for example, between some of these neurodevelopmental conditions. So the omega-3 index has been explored in autism and schizophrenia. In my own research at the NIH, the NORA trial, we found an omega-3 index of about 4.2 in the adults with ADHD. Bear in mind, 0 to 4 is suboptimal. Another researcher at the University of Oxford found an omega-3 index of 2.4% in UK school children. We found in this recent research that I've mentioned with the University of Roehampton that the majority of the group did not have optimal omega-3 indexes. So yeah, increasingly the omega-3 index is being used to explore the relationships, as I mentioned, in some of these conditions. But other nutrients, we're not there yet. I mean, I know, there's been a mixed bag of findings like low B vitamins, low magnesium, low zinc. These keep coming up time and time again in ADHD and autism. We know that children with ADHD and autism kind of fall into the fussy eating category. So they tend to be food avoidant and food restrictive, like especially children with autism due to kind of sensory aversions. They don't like food groups to be touching. They can have emotional meltdowns if the peas touch the chicken, or they want things in separate bowls, or they only want to eat the beige foods. All of that is known to increase risk for something called gut dysbiosis. And also when you're only eating a certain type of food, processed, ultra-processed foods, you can increase risk for the development and growth of pathogenic gut bacteria. So essentially the colony becomes imbalanced, which again increases risk for inflammation. And given that 90% of serotonin is made in the gut, that creates problems. So it's a very complex symbiotic relationship as well, because I've noticed that children with ADHD and autism that come to see me are often eating the very foods that we find that they're intolerant to. So it's almost like the cravings, the gut cravings are directing the food intake of the host of that young person, which again is feeding the dysbiotic bacteria, further contributing to an imbalanced gut microbiome.
Very interesting. See, I don't think parents know these things.
Yeah,
I
it's fascinating.
Yeah, I want to ask you, I want to turn a little bit to medications and alternative therapies. So many children with ADHD are prescribed amphetamines like Adderall and Ritalin. I'd like to hear your thoughts on that, but also I've been reading a lot about emerging interest in mushrooms to treat ADHD. What are your insights about this?
So which question first?
Well, the Adderall and Ritalin, which I don't know, for as long as I can remember, I think I've heard those two drug names for, children with ADHD or ADD. So first on those two.
Yeah, I mean, I think psychostimulant medication is kind of synonymous with ADHD. That's just the way things have emerged. And again, it's that kind of biomedical disease model, treatment model. You've got to look at the way that the medical students are trained, and they're trained according to this specific model. So
Mm,
they will know, they'll be taught about symptoms and their, prescribing medication counterpart. It's about matching symptoms with treatment. And yeah, so that's the way they're trained. In terms of alternative treatments, there is emerging research to suggest that mushrooms like lion's mane, psilocybin mushrooms maybe contain or have therapeutic benefits. I mean, the research in its infancy, but we know that there are new clinics emerging in highly reputable academic institutions like King's College London. They actually have a psychedelic clinic. The work
mm,
in Professor David Nutt, who wrote the book Psychedelics here in the UK. His research is fascinating. And I hope that we'll get to a point where, the approach to ADHD and brain health goes beyond the prescription pad. I'm not saying there isn't a role potentially for psychostimulants, but these are powerful, oftentimes FDA black box warning drugs that can be given to 6-year-olds. So we have to sort of
yeah.
slow down a little bit. What's the end goal here in terms of obviously parents are so mindful because education is the gateway to their child's future. So there's that pressure of parents to medicate as well because they don't want their child being excluded or not making the grades. And I mean, I personally have known, professors in academic institutes to take these potent drugs to stay up all night writing grant applications. So, we know how powerful they are. They have very high effect sizes, but they also come with risks, of course. I don't think it should be a competition. I think the future of medicine is personalized, it's integrative, it's holistic. There's room for a combination of different interventions and treatments. And I think you need to do everything together as much as you can as a parent. So, for example, like I'll just take my own experience. My son was enrolled in gymnastics and trampolining. He was in an athletic club. He represented our town for several years. He did boxing training. I'm not saying every parent can obviously provide these opportunities, but enroll them in what they love, nurture their interest. My son's an artist as well. He loved to paint. As I said to you, very early on, he was doodling while in the classroom. That got him into so much trouble. But, now it's kind of accepted that children with ADHD do this, but it wasn't back then. But yeah, find, there should be a balance. And I think, Dr. Amen speaks really well about this. He says, look at the biological, look at the psychological, look at the spiritual, look at all the different aspects. We all need balance in our life. It can never just be, here's your 30 milligrams of Ritalin on your way sort of
Mm,
thing. That's like putting a band-aid over a wound. That wound is not going to heal. We need to consider a combination of things. And also, relationships are absolutely critical to the success of a child. Good family relationships, a
mhm.
calm environment, nurturing that child, taking an interest, spending time. Time is the most precious gift you can give another human being. And
So
sadly,
true.
going without the time of their parents because their parents are just working so hard. People are living from paycheck to paycheck. We've got to stop and we've got to pause, we've got to reflect and we've got to think, is this really how I want to live? You know, it's tough, but
Mhm.
yeah, certainly lion's mane, which are powerful antioxidants, are certainly going to help brain activity for sure.
Yeah. I love what you just said there. Is this
Thank you.
really how I want to live? Stop.
Yeah,
And
yeah.
think. That pause is so important.
We're just
I
all in a hurry, aren't we? We're all in such a hurry. It's like, hurry for what?
for
What is
what?
the end destination? Where are we going? We get one chance at it, or we may get others, but that's another conversation. But this is our life. We have to have balance, and we have to have, really precious moments, and building a relationship with your child, especially as they go into the teenage years, the most turbulent, challenging times. You need those solid relationships to carry them through.
So true. So true. We could do a whole other conversation on that because that's
Absolutely.
very. I want to ask you something, and I'm going to put aside the nutrition and the medication for now. And the question is regarding video games. I have heard mixed reviews regarding children wanting to play video games. And most of the time it's boys, and I don't mean to sort of say it's only boys, but there's a whole school that says, the video games help them concentrate and focus on the task at hand. And then there's this other schooling that says it forces them to do short-term focus, which hinders the long-term memory and focus. Where do you fall on allowing, whether your child has ADHD or not? Maybe it's a result of having it that they need it or don't need it. I'm not sure. What are your thoughts on that?
Yeah, it's an emerging field, isn't it, in terms of, does technology help or hinder? It kind of reminds me of the Jean-Jacques Rousseau debate back in the age of the Enlightenment. Have the sciences harmed or advanced morals? Now we're having kind of a very similar debate in terms of children and tech, and there are mixed findings. Some research saying that tech can really, really help some children. And then obviously there's also the concerns about increasing risk for poor mental health. And, it's such a minefield, isn't it, really? It's
Yeah.
just, it's a whole new world. I mean, yeah, it's a whole new world. I think that screen time has to be regulated, it has to be monitored. I mean, is it Australia that they've now banned social media until child 16? Is that correct?
Yeah, I think Australia did. I know here in New York, the schools, at least the public schools, are trying to ban phone usage or just having your phone at all in school. So you hand it in the morning and you get it back at night,
Yeah, that's a
or
great
when you,
idea.
so, who knows? But there's conflicting conversations that is ongoing. What do you think is the biggest misconception about ADHD?
Well, I mean, when my child was diagnosed, and I remember sort of going back to well-meaning family and communicating that diagnosis, I was quite surprised because it was met with a lot of criticism and, responses like, oh, isn't that just some funny made up label for naughty boys? And, oh, that's an invention of the pharmaceutical industry, isn't it? It's caused by watching too much television or too much screen time. Yeah. So basically, obviously we know it's not a label for naughty children. We now have decades of neuroscientific, genetic, epigenetic research showing it's a very real neurobiological condition. And yeah, I find that oftentimes it's literally just a lack of knowledge and a lack of cognitive flexibility to challenge yourself. I would say to someone who has very sort of hard, fixed opinions about ADHD. One, be open-minded. Two, go over to PubMed, which is the largest
Mhm.
database of clinical published research in the world. And three, speak to people who have the condition, to better understand it. It can be absolutely debilitating. It can lead to all sorts of problems with the individual, including educational failure and increased risk of criminality, youth offending, substance use disorder, in drives to kind of manipulate their brain's biochemistry, because hypothetically, because of lower dopamine, and lower serotonin and things like that. But yeah, I mean, I think there's a lot of myths and controversy, and I think a lot of that can be attributed to its name. I mean, ADHD is a funny name and it doesn't quite reflect the condition either, because people with ADHD actually can hyper focus and have superlative attention skills in an area of great interest, passion, and they have the ability to kind of shut out the outside world and focus intently on something of great interest. So yeah, I mean, I think the name that it's been given is probably, not ideal. And yeah.
Interesting. So I want to just touch quickly on education. And I've read, and you mentioned in your book also about some programs, and I've read about some initiatives here in the US. There's one called the SUM program, where educators, counselors, community members, they all come together to work and design inclusive learning environments. And this one was for children with autisms and other conditions. My question is, what strategies can teachers use to better support ADHD students in mainstream classrooms? Because I'm sure there's many students that have ADHD that are in the mainstream classrooms, and probably the ones you're mentioning that get labeled the way that, we just discussed. But what would be a couple of strategies that the teachers could use to better support these students so that they can just continue to learn in just a standard classroom?
Yeah, I think obviously under the Equality Act 2002, there's a whole long list of reasonable adjustments, and I believe you call them accommodations. Yeah. But first of all, first and foremost, identifying children who are neurodivergent, like learning how to recognize signs of, difference. I get that teachers are not psychologists and it's not their job, but then maybe having a school psychologist is a good thing. I know you have school counselors in the US, which is fantastic. So early identification so that you can support that young person, and understanding how some of these learning differences can manifest differently between boys and girls, and, sharing strategies for fostering a supportive and inclusive learning environment, flexible arrangements, sensory friendly spaces, clear communication, also bringing things like the nutritional sciences back, educating children about sustainability and about foods and about how foods can be protective in terms of their brain health and cognitive functioning. Communication is everything as well. And we've got to understand that many neurodivergent individuals have exceptional skills and can bring those skills into the workplace if they are nurtured as a child. Oftentimes neurodivergent individuals do really well in technology, where traits like hyperfocus, creativity, and problem solving can be leveraged. I mean, I love the story of the gentleman who invented the Sony Walkman. I think his surname was Kaihara, something like that. He is cited as having ADHD, and I know that he was finding it incredibly difficult coming to work every day on very packed tube trains, having to work in busy offices with lots of people. He was struggling, and luckily Sony gave him accommodation so that they made special adjustments for him, allowed flexible workspaces, and also allowed him to work at night. And he created obviously a portable music device, that basically shaped Sony completely. It made it the large corporation that is today, arguably. Had he not been given those, reasonable adjustments and flexible working accommodations, then the Sony Walkman may never have been invented. So, and also large corporations like Microsoft, have been spearheading recruitment campaigns for neurodiversity and individuals who have neurodivergent conditions like autism, and they do have flexible work hours, option to work from home, sensory friendly work environments, quiet workspaces. We need this all at school, because it's these children that can go on to become the next giants in terms of their contribution to society. Some of our greatest writers, inventors, entrepreneurs are all ADHD and autism. So we really do need to sort of change the way we think about these conditions. We shouldn't necessarily have to change the child by way of medication. Rather, we need to shape the environment to accommodate the child so that that child feels included, has a voice, is very much part of their learning environment.
Yeah. That's a great story about the Sony Walkman. I didn't know that. That's a wonderful story. And I think what you said about the bringing the education of nutrition into the schools, I think would be very helpful as well. Not just
Okay.
for the teachers and the parents, but the students themselves as they learn that what they eat
And
has an
garden.
impact. Yeah, yeah, I think that's wonderful. That would be a great way to sort of kickstart the process.
But you can say oftentimes children are not being taught about the origin of foods, and also that when
Yes.
you plant something and you have to water it and you have to make sure that the soil is just right and it has exposure to sun and it has the nutrients, and learning about the minerals and all the right ingredients for that plant to grow and flourish. That is an element of nurturing that is not necessarily being taught, how to tender, how to care, how to take the
Mhm.
time. And yeah, and learning about the origin of foods is really, really important.
Yeah, yeah. And how it impacts their body
Yeah,
and their
that's
emotions and their feelings and all of that.
brain health. Yeah.
So we're coming to the hour and I need to close. And we have a closing tradition on our podcast where we ask our guests to provide one key piece of actionable advice for our listeners. And the question for you is, if I'm the parent of a child who's frequently labeled with the labels that you mentioned earlier, troublemaker, not paying attention, bored in class, all these things, but I don't have access to professionals like doctors, teachers, or counselors who understand and can spot the signs of ADHD, what first steps would you recommend for these parents who perhaps themselves also don't have the means or the knowledge so that they can start to educate themselves and ultimately advocate for their child?
Yeah, I mean, I think when you are a parent of a child who has a neurodevelopmental difference, you often become a special type of researcher. I used to say, you become a better researcher than an FBI agent, because you basically want to know everything about that condition. You want to be able to understand it so that you can help your child thrive. And I think building a community is so, so important. Speaking to other parents who are going through similar journeys, building a network, seeking the help of teachers, friendly teachers that have time to listen and, help put a plan in place. Um, there's so much online now in terms of TED Talks, and there's so many non-for-profits that organize resources and activities and teach skills and are there for parents who are basically struggling financially, for example, low-income families. There's so much that we can do. And I think, one of the most important things to remember is, that you're not alone, and there are millions of parents worldwide who are going through this journey or who have gone through this journey, who can help and guide and, serve as teachers, if you like, because they have stood in your shoes. So you're not alone, even though it can feel incredibly isolating at times.
Mm.
Um, and remember that, I think it's really important as well that parents take time for themselves to have that kind of self-love and care for themselves, because it's really easy also for the parent to become despondent and feel hopeless and to even become depressed themselves in the process, because raising a child with a neurodevelopmental difference like autism or ADHD is challenging. And it can be really, really tough. So I salute all the parents out there and remind yourself that you're doing an amazing job. And yeah, that's why I published like my book in particular, so that it can be a resource for other parents out there and just a reminder you're not alone. And also on my Instagram, which I'm sure you're going to be tagging me in, there is so much information on there. It's like a wealth of free information about the brain, about these foods, everything that we've spoken about today.
Dr. Gao, thank you so much for your insightful discussion. We truly appreciate your expertise and the work you're doing to bring awareness to the role of nutrition in ADHD. Before we wrap up, where can listeners find your book? I found it on Amazon. Any other suggestions where they could find your book and the work that you do? I know if you have an Instagram, we'll tag that too.
Yeah, I mean, it's nutritiousminds.org and the Instagram at nutritious_minds. And of course, the book, which, yes, you're correct, can be found on Amazon.
And on that note, thank you all for tuning in, and we hope to see you next time. Until then, be well. As we close, I want to thank you for joining me on the Her Notebook podcast. I hope today's conversation brought you some knowledge and sparked new insights. If you enjoyed this episode, I humbly ask that you please remember to click the subscribe button below. Until next time, keep flipping your notebook pages and embrace the journey to a healthier, happier you. See you next week.